Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome, everyone, back to the Tongue Tie Experts podcast. I'm Lisa Palladino, and I'm very excited to have today one of the experts in the field of laser technology, Dr. Peter Vitruk. Dr. Vitruk was born and raised in Ukraine. He earned his PhD in physics in the late 1980s in the former USSR. In the 90s, he held research scientist position with the Academy of Sciences in the former USSR, and then a Royal Society visiting research fellow position at Heriot-Watt University in Edinburgh, Scotland. He later worked for several laser companies in Seattle, Washington. In the 2000s, Dr. Vitruk founded Luxacare, a Asculite Light Scalpel Group, the American-based designer and manufacturer of exclusive flexible fiber surgical CO2 lasers for small office outpatient market. Dr. Vitruk has co-authored 10 patents and over 50 articles on CO2 lasers and is a member of the Institute of Physics in the UK. In 2017, he founded the American Laser Study Club, which is how we met, an educational platform that helps physicians, dentists, veterinarians, and practice staff members to excel at efficient and safe application of laser energy in everyday practice. He is married to his wife of 37 years, Natasha, and they together have 2 children, Olga and Alexander, and I know a new grandson as well. So welcome, Peter. That was a lot because you do have quite a history and quite a lot of experience and a lot of scientific experience behind you that we will try today to translate nicely for people to understand what we're talking about when we get so excited about your laser. So welcome, Peter.
Thank you, Lisa, very, very much. It's my pleasure. And I cherish any and every single opportunity to convey a very simple message. Physics is actually pretty simple, and it's pretty easy for parents to understand and then to make an educated decision. Which way do they go?
Right.
So thank you again, Lisa.
Yeah. So I know that when I first asked you to come on, one of the things you asked me was like, well, you're used to presenting to professionals mostly, where you're showing us graphs and slides and lots of technical information about wavelengths and physics and all kinds of really interesting things. But we can't do that by audio. We can only do that with video. But we're going to talk today because the reason that I think this is really crucial is because both in the population of parents who are deciding whether or not to have a tongue tie procedure for their baby and the professionals that are considering using laser in their offices, there are so many differences among different types of lasers. And also just the word laser sometimes can be a scary word for those who don't understand how they work, right? So how did you get into lasers? Like how does one like grow up and be a laser professional?
Well, that was a super long time ago. It was still back in the USSR. I did my physics PhD within the Soviet Academy of Sciences. And my thesis was on the plasma physics and laser resonator optics, all with the instant applications and a new type of the lasers. So nowadays, they they dominate the surgical and medical applications. So that's the CO2 laser of a very special kind. It's pretty compact, which is a must-have for the commercial applications. It can be very rugged, and again, that goes a long way. And what's also important, there is a way to make it very inexpensive. So that's what we use on a light scalpel lasers, that type.
Right. So that's why dentists are using this in their office because of it's convenient for them. It's easy to use. It's more affordable than lasers were, or different types of lasers may be.
Right. So it's kind of, in another word, some kind of the one-trick pony, just the CO2 lasers for almost 40 years.
Right. So, we were chatting a little bit before we started recording about what you want a laser to do. So a frenotomy or a frenectomy can either be done by scissor or laser or even scalpel. Some people use cautery, Lord help us. But what would be the reason that somebody would say, here's a laser and this is why it's better at the procedure for those who are trained in using it, or easier or safer, etc., than using the other methods?
Yes. So first of all, I appreciate that question, just because the kind of big part of the deal to understand something is actually to articulate the question first. Kind of what is it that we want and what does that thing do? Lasers are not kind of the rainbows and unicorns. That's not really that part of the big magic. So if we were to simply start with the kind of the clinical side of things, kind of whatever we call this device, doesn't matter what we call it, but what is it that we want it to do?
Right.
And but then instantly we go like, okay, so what is the application? Are we doing the LASIK surgery on the eye? No. Are we doing a hair removal with the laser beams? No. And so what is it are we doing? So we really need to be very specific as to what is that application. Laser is not a magic fix for anything and everything. And whenever I hear the term all tissue laser, I'm kind of, this is borderline insane. So if we are talking about the frenectomies, so instantly we're talking about the vascular tissue surgery.
So for the lay people in the audience, that's surgery that's involved in a place where there can be bleeding.
Correct. Yep.
A lot of circulation is there, and there's an opportunity for bleeding.
Right. So then, and what is it that we want to do? We actually want to do surgery. We want to do the pretty superficial, incision, but still we are going into mucosa. There are some capillary blood vessels, God forbid we hit on a larger blood vessel. So first requirement, that laser beam needs to be have the ability to vaporize the tissue. And that's the action. The laser beam can vaporize very precisely, very superficially. It can vaporize the tissue. So that's the first requirement. And then, but the second requirement is if we are able to produce a super nice incision, just like, scissors can in the expert hands. So the next question is, okay, so you purchased yourself a $200,000 laser, but what does it make it better than a $10 scissors or $100 scissors? Right. What is it that you really want that laser to do? So the instant answer is, well, we don't want to have bleeding. So now we articulated it has to cut and it has to create a hemostasis or coagulation at the same time instantly. It's not like we're cutting today and coagulating tomorrow, because there are quote-unquote lasers.
Yeah, let me just translate for the lay people. Coagulation is a fancy word to say for blood clotting. So we don't want we don't want it to bleed. We want the blood to coagulate, to clot, so that there's no bleeding. So you're cutting and hoping it doesn't bleed all at the same time, which you can't do with a scissor or a knife. It's going to bleed when you cut.
Correct. Yeah. So if we just can honestly answer this very simple question in a very simple way, that this device, whatever you call it a laser. Well, if it's a laser, then there is a laser beam. So then it has to be able to precisely and very gently cut, and precisely and very gently coagulate. Great. Right. So then we have to simply look at which laser can or cannot do either of that. But at least if we can simply articulate what is it that we want, we kind of like we on a 50 percentile mark of understanding what is it that we want that laser to do. Right. Cut and coagulate and hemostasis at the same time.
Right. So when you were designing your laser specifically for this very purpose, you were looking at how do we get that to be that specific.
Yep.
And I just want those who are listening to understand like how specifically exact this is. I've played with the Light Scalpel laser. I've played with other lasers as well, but we will talk about that today. And we learn, the first application we learn on is a tomato. And you can literally take away the top layer of the skin of the tomato, not even going through the skin, just the top layer of the skin of the tomato, which to me is such a great illustration of how specific and exact it is. So
and gentle,
yes. And the other thing that comes into play when we're talking about frenotomy is thinking about comfort. And, I don't know if we have any studies or proof about is it less painful with the laser or not, but extrapolating the information of that, it's quicker, it's more precise, and there's less trauma.
Right.
Because of how precise it is.
Yes. So I can definitely cover the pain, post-operative pain. Simply referring to the published literature. Right. But before that discussion, it's important now to kind of follow through that two points, vaporization of the tissue and the coagulation. So this is where we kind of go in the direction that a laser is not a laser, is not a laser, is not a laser.
Right.
They differ by what is it they can do on a target tissue. Okay. So let me give you a couple of examples. For instance, everybody knows about the LASIK. So the LASIK beam can super precisely vaporize the cornea very superficially. But
Right.
here's the big question. Do we want any coagulation or thermal effects on cornea? Absolutely not.
Right.
So this
you
is
don't
your
want it to be
example.
hot.
Yep.
You don't want it to be hot at all for those.
Correct. So
Right.
this is your example of the type of the laser that does one thing, but does not do the other thing. Another example is a so-called hard tissue laser that cuts teeth. Okay, so then here's the big question. What does that to coagulate in enamel, So that's another example of we want that device to cut, but we don't want any thermal effects, if we can.
Right. I mean, it's like you wouldn't use a steak knife to cut, a piece of fruit. It's that kind of thing, right?
Exactly.
You have a different tool for each different job because it does it better. I mean, that's a different.
So this is also me saying that as far as the LASIK type laser, useless for the frenectomies. The hard tissue, specifically the erbium, a very specific name. There are some commercial names, no need to mention them. But just erbium lasers, great for etching the tooth. Not so useful for the vascular soft tissue surgery, which is, by the way, the reason you will not find a single erbium laser outside of the dentistry.
Okay.
For the vascular tissue surgeries. It kind of tells you a lot about what's going on in dentistry.
Right. So there are different types of lasers that a dentist might have in his office. So
correct.
A dentist doing different types of procedures may have or should have different types of lasers.
Yes.
That he uses. He doesn't use one laser for everything.
But that's an ideal world, like for instance, in a cosmetic surgeon's office or the plastic surgeon's office, when you can easily see 10, 15, 20 different types of lasers for wrinkles, for that type of the skin, for the other type of the skin, for hair removal, for the tattoo removal, for so many different applications. So let me give you another example of the laser, which is used by physicians and by the dentists. And that's the so-called diode laser. They are popular in dentistry because they're very cheap.
Okay.
But outside of the dentistry, they are actually designed to be very powerful and expensive. So what is it they do? And the answer is hair removal, for instance.
Okay.
So now, and the way that application works is that laser beam gets into the skin, under the skin, and the properties of the dermis, that the stuff underneath the skin, scatters that expensive laser light sideways. So they can hit hair follicles from the side, and they can make them fry, fall out, great application. So the big deal in those kind of applications is that that laser light, expensive laser light, goes after very specific targets, hair follicles, but they cannot cut the soft tissue.
Okay, which is good if you're doing hair removal because you don't want to cut the skin when you're removing.
Right. So now the diode laser in dentistry cannot cut the mucosa or the frenum with the laser beam. So, and then you simply realize that in the world of the commercial lasers and dentists, there are only three types: the diode, the erbium, and the CO2. So the diode cannot cut thickly with the laser beam. Erbium cuts perfectly, but cannot coagulate deep enough. Now the CO2, it just happens to have the ability both. It's not your best cutting laser. It's not your best coagulating laser. It just gets you both. Okay. And that's what found the application. The reason that it has so many applications in soft tissue surgery across all of the dental and medical specialties, and also in veterinary medicine. Veterinarians
I was just going to say that, right? Veterinarians use your laser as well.
Yes.
Yeah, that's fascinating.
Right. So if I kind of finish it all with so there is a way to turn the diode laser into the electrocautery-like device, which is the hot tip. And in electrocautery, that's the electrical current that heats up the metal tip.
Okay.
But the diode laser, it's the laser beam that heats up the glass tip.
Okay.
So from the get-go, you're facing some questions like how rugged and how fragile the glass tip is, and so on.
Mm-hmm.
But when you are cutting with the electrocautery or the diode laser, there's a pretty big risk, and quite often this actually happens, that depth of coagulation is excessive. But what is excessive? Well, the blood vessel capillary diameter is think about like half the thickness of the human hair. It's very thin capillaries.
Right.
So with the electrocautery, you are coagulating like 10 times deeper, 20 times deeper. So you're creating excessive depth of the coagulation, borderline creating the thermal burn. Right.
And I have seen frenotomies done by that type of laser, and it looks almost charred sometimes. Yep. And it's definitely more uncomfortable. And this whole interview is, I don't want people to think like I'm making a commercial for your company, because it sounds that way, the way I'm talking it up, but it's my experience. The reason why I recommend dentists who use a CO2 laser, the reason why, I invited you to be on, is because nobody has ever explained this to me, or probably to other lactation consultants, the differences in the laser. And after seeing your very complete presentation on the physics of this, it made me understand my experience from seeing other different types of lasers, procedures, what it was like post-op for these babies. And there was some pretty sad situations that I saw. Now, that being said, somebody could purchase your laser and you do very good training, but people are, they're responsible for what they know how to do and how they use it. So it's not a panacea just to have the laser, which is something we'll talk about in a little bit. But in general, I always like to say it's not just about the tool, it's the provider using the tool, because there are many providers who do scissor procedures amazing, and that's all they know how to do, and that's fine. But there are also some providers who use whatever they have and try to change the application for something that it's not meant to be for. So that's what I've seen sometimes, which isn't a good result. Does that make sense?
Yes, absolutely.
Are you a professional that feels like you didn't learn enough about tongue tie in school? Whether you're a lactation consultant, a nurse practitioner, a midwife, a doula, a doctor, a speech-language pathologist, a chiropractor, PT, OT, dentist, etc. I don't mean to leave anyone out. Anyone who works with pregnant or breastfeeding families in any capacity who is curious about tongue tie is welcome in the Professional's Guide to Tongue Tie in the Breastfeeding Infant. What you'll learn: we have 4 modules: assessment, treatment plan, frenotomy, and aftercare. So much great information, and it comes with a community. I didn't learn this in school, did you? Tongue tie treatment can be complex, and those who expect relief of symptoms with a quick snip or even a laser release, even by an experienced provider, are usually disappointed. Join me to learn protocols that offer an organized and simplified plan to support families through decision-making, preparation, treatment plans, procedure if needed, and aftercare. Learn the teamwork model of care. Knowing why and which providers are necessary will make things easier for you and provide effective outcomes for your patients. Please sign up today. The link is in the show notes, but you can go to my website, tonguetieexperts.net, go to the professional tab. And one last thing, since you listen to my podcast, you'll get 15% off just by using the coupon code podcast15. And the word podcast is all in caps. Can't wait to see you in the group. Take care.
So I want to talk a little bit about the training, about the American Laser Study Club, because I think that's really cool to know about. Because, I mean, how geeky does that sound? Like, I lectured for the American Laser Study Club. It sounds like nothing I'd ever have imagined myself as a midwife or a lactation consultant. But the reason that I love being in that situation and being among the people that come to your conferences is because of the amazing multidisciplinary learning that goes on, and conversations like we just had about the results with this thing or the results of that and what we're looking for. These go on, and there's so much networking and education going on, even among the members. Plus, you always have great speakers, and we learn from each other. So tell us a little bit about American Laser Study Club.
Yeah, so the idea about American Laser Study Club came about after trying everything else as far as the education. And so I was helping another society for 5 years. It's a dental society. And then after 5 years of trying to bring in a very simple laser tissue interaction physics from the physicians, from the medicine to dentistry, big politics on it.
Yeah.
Done with that. Let's move on. Started American Laser Study Club, and instantly it became a very friendly and very powerful professional platform, especially for the dentists who are operating in this new and very dynamic field. Tongue ties, slip ties, oral restrictions, and from the, being the engineer and a laser physicist, but even I understand that's it's not just owning having the laser,
right?
It's the why. Why are you performing this procedure,
right?
And if you even have the reasons to go and start, the next big question is, where do you start? What's your start point?
Right.
So then and then how deep you go, how wide you go.
Right.
So all of those clinical questions instantly bring in all the specialists like yourself, lactation consultant, registered nurses, speech language pathologists, or myofunctional therapists, physical therapists, because this is such a multidisciplinary field where just like you saw on a tomato, I can teach a dentist, give me 10 minutes and we're going to be safe going into the live patient only if we have the proper equipment and we have some of the simple techniques down. But we cannot teach, American Laser Study Club cannot really pretend to teach anything about the clinical. You went through years of your education. Dentists went through their programs. So the American Laser Study Club became that platform where for our meetings, the symposia, it was kind of a unique concept where he just did not want to have, quote unquote, key opinion leaders to teach for 3 days. One faculty teaches for 3 days or so. So the idea was to bring in as many clinicians across all of the specialties and to contribute into this common topic from all these different angles. Like, for instance, how do we suture? For instance, do we suture or not, and when and how? And So
yeah. So what I think is crucial is having, like you said, you were trying the politics, bringing the medicine and the dental together is, there's always, when you're dealing with the powers that be, it's very hard to get different professions to listen to each other.
Right.
And there are a couple of tongue tie associations that do this pretty well as well. The interdisciplinary learning, because we usually learn in silos. We usually learn, like, if I go to a midwife conference, it's just midwives talking to midwives. If I go to a lactation conference, it's just lactation consultants talking to other lactation consultants. But here, it's doctors and dentists listening to the physical therapist or the chiropractor or the lactation consultant, and vice versa. And we're learning from each other. Because, as you said before, the clinical, here's the other thing about it. Just because you can purchase a laser doesn't mean you know when the function needs to be improved.
Right. Yes,
right.
Absolutely.
So
absolutely.
There's that learning curve too. And those who do well in this, I mean, you've heard me preach about the team approach. We're interacting with each other about the patient, deciding the proper timing, what the patient needs before or after the procedure. And this is different depending on the age of the child, but even a newborn, like maybe it's not time for that newborn to have the frenectomy, even though it looks like there's a frenum that's restrictive. Maybe we need to work with mom on her milk supply first, or whatever it may be. So I love being able to share my knowledge and my clinical experience and applications with those who are learning how to use the laser. It just makes perfect sense, So that's what I love about American Laser Study Club. So is there anything about the laser and what we're talking about that I haven't asked you that you think it's important for our audience to hear? I mean, maybe from the parent side,
I think from the parent side of things, it's simpler to kind of think about, there is only really three types of lasers in dentistry. Not 300 million, just three types. Mm-hmm. They are diodes, they are the erbium lasers, and they are the CO2 lasers, just three. So whenever you hear laser frenectomy, the correct question is, which type of laser is it?
Right.
So if it is a diode, it's a hot tip. It's a hot tip cautery. So I have a personal story with my daughter traveling in Europe. We did have the emergency operculectomy needed to be done, inflamed tissue around the wisdom tooth.
Okay.
And unfortunately, the circumstances were such that the only option right there and then was the diode laser. Mm-hmm. And then I even wrote a little article about it in a dental sleep practice journal. 3 weeks after the surgery, she was in pain, and the pain was on a 10 on a scale of 10.
Wow.
Why? She was a burn victim.
Wow.
Such excessive depth of the thermal impact,
mm-hmm.
it does not heal well.
Right.
So she was 24 at the time, an adult. The solution was the painkiller.
Right.
But imagine, can you really use the strong painkillers for the baby?
Right.
The answer is not.
Right. And the trauma that causes for a newborn.
Exactly. Yep.
It's so sad.
So kind of 5 years ago, a lot on the Facebook discussions were such that lasers burn, scissors are the greatest.
Right.
Well, diode lasers burn. But when you go into the other type of the lasers, for instance, the CO2 laser, so then if you simply kind of know this little piece of information for the skin resurfacing,
mm-hmm.
the king, kind of the golden standards of the using the laser with the pretty dramatic and still very kind of the gentle effects, it's a CO2 laser. It's
mm-hmm.
not any type of laser.
Mm-hmm.
So now you think but skin heals so much worse than the oral tissue. So if there is a type of the laser that can get you such excellent results on a pretty tough clinically the target tissue, this is one of the reasons why it works so well on the oral tissue.
Right. So in other words, if it works so well on skin, it's going to work even better.
Exactly. Yes. Mouth. So incidentally, when my grandson was born, within a week, my daughter-in-law, she was very brave for 1 week, but because of the oral restrictions, he was working hard on the breast for about 20 minutes. He could not extract anything because of the hardware was not working. He falls asleep hungry.
Right.
Sleeps for 20 minutes and he is back at the breast.
Right.
And same vicious cycle.
Pain again.
24/7. So then Anya, my daughter-in-law, said, Peter, call Dr. JT, my friend here in Bellevue. So at 2 weeks of age, and the decision was, it's my grandson, and I thank God I know what kind of laser is it and why. Right. So it was the lip tie, tongue tie, 2 buckle ties.
Wow.
Each side took
He won the
seconds.
He won the jackpot, your grandson.
Yes. And what's amazing, Lisa, was that during these 2 weeks of compensating, he made his upper lip work in a very specific way to extract some of the milk. Right. So after the frenectomies, with the lip tie and 2 buckle ties gone, his memories already were set. He did not want to change.
Yeah, it's hard.
So then
you gotta retrain the mouth. Yeah, that's what we do.
Exactly. And this is where the post-op therapies were so super important. And again, this is not just the laser frenectomy. Right. This is what comes on the front end, what comes on a post-op end for the best results.
Yeah. So we have that shared experience of both having grandsons. Your grandson's a little older than mine, but my grandson too had to have a tongue tie release. And yes, we chose the CO2 laser, and I'm hoping my daughter will come on one day and talk about her story. But it was so much more for him. It's more than that, and it's also about. He was in a very awkward position during the last few weeks of her pregnancy, and he kind of got stuck in a position in her pelvis, and his head is was a little bit off-centered, so he wasn't able to move his head in the proper way to open his mouth, and then he had the oral restriction. So we did OT and PT and working with myself and an SLP before the procedure. Then he had the procedure. He recovered well. Believe it or not, my own grandson has a little bit of reattachment, but we're still working on the body work around it because it's not just about that frenum, right? Exactly. Yeah. Not just about the frenum.
And you know what amazing for me during that experience? For me, the experience was that I've been present during my travels, probably at the 200, 300 frenectomies at the dental offices, some other specialists too. And so I knew how fast and kind of uneventful procedures are. Babies don't really make much noise, but I never saw the patient post-op.
Right.
It was always a mystery. I've heard about it.
Right.
So the first night when they brought my grandson Leo home, my granddaughter said, "Oh, he's a little cranky." But what I told her, look, 2 weeks of his life before that was living hell. Forget about cranky. Right. So we were ready with the Tylenol, baby Tylenol and Arnica and everything. He didn't need any of that. Next day, he was just like, an industrial pump. He was just extracting that milk.
It's amazing how fast the little ones learn new ways, right? In the perfect world, it's a very satisfactory procedure in that things get better quickly. And then for some, it's a little bit more involved. But I'm just grateful that we have the right tools and the right professionals who are trained to use those tools or not, because, you don't want to be cutting.
And let me also mention, Lisa, that it is my belief that if you know your tools and you can adjust, then you can still make a pretty decent use of them. I've seen frenectomies, pretty sophisticated frenectomies done with the electrocautery. But that was in their super expert hands, super experienced. And One of my favorite examples is how Dr. Zaghi uses. He's using the CO2 laser. He's using the scissors and hemostat technique. But there is so much expertise and knowledge of the anatomy that goes to the success. And part of this big success is it's the pre-op oral myofunctional therapy.
Right.
It really does so much magic. Right. Prepares the patient for that procedure. That it really kind of know your tools. And if you like the CO2 laser, God bless you. If you have different tools, then they just recognize the differences. Can you make them? Some of them you can make not as good as the CO2, but you can still make them safe, not as fast. But just knowing the tool, education, and it's not just the tool, it's everything that goes around pre-op and post-op.
And back to the theory of it's not as much the tool, but it's the person operating it. So if somebody has a diode laser that they've been using their whole life and they know how to adjust it and they know the specific settings and they're careful and they know exactly how they have to use it, they may be good at doing that procedure with that tool, but not everybody has that precise knowledge and training and experience to be able to do that. So we're glad that we have these amazing tools. I mean, before I got into this field, I had no idea. Like I had heard about laser hair removal, but I didn't really know what a laser was. I mean, I went to school in the 80s. So, that's before things were even happening with laser. Laser was the thing that in Star Wars they fought with. Right? That's what a laser was to me. So we've come so far. Thank you to scientists like you who've done the research and developed these tools to make things easier for us. So this has been a great conversation. I am so grateful that you took the time to spend with our audience today to explain all of this. I think it's a very unique conversation, one that a lot of people will never have heard about before. And, I think I'm very grateful that you agreed to come on the podcast today. Thank you so much, Dr. Vitruk, for being here. And one thing I want to say before we sign off is, I know that you are from Ukraine and you still have family in Ukraine. Yes. And with everything that is going on, we want to acknowledge, and honor what your countrymen are going through and also help to contribute in any way that we can. So I'm going to include a link in the show notes where if people want to donate to the Ukraine cause, they can click on the link in the show notes and give whatever they can. If everybody who listens gave a couple of bucks, it would definitely help out, right?
Right. Absolutely. Thank you so much, Lisa.
My pleasure.
Thank you for the opportunity and for this call for Ukraine. Thank you so much.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way, For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.